Good evening, anyone that's out there. My name is Mark Magnusson. I'm a plastic surgeon. I work in Queensland, on the Gold Coast, and also in Toowoomba. Tonight's topic is going to be on Brazilian butt lift, which is a little bit topical. That's fat grafting to the buttocks as opposed to buttock implants. There are two main goals in using fat grafting for the buttocks, and predominantly it's for shaping and size, which aren't always the same thing. Shaping is certainly the main element for a lot of women, but there is certainly a group of women who are wanting to have a little more junk in the trunk. This is a procedure that I do relatively commonly. I do quite a lot of body contouring surgery, and with abdominoplasties I perform now, it makes up, or buttock fat grafting is probably in about 1 in 3. And then there are some ladies who are choosing to have this procedure simply to shape or resize the buttocks. And consequently, the concern is, where can we obtain and where can we take fat from? Because the areas we take fat from need to be managed in an aesthetic way as well. Now, we had some questions that were offered up prior to tonight's Facebook Live. Okay, we've got a question here. So why are Australian Brazilian buttock lift results so much more natural looking than those we see advertised in America, Mexico, or Dominican Republic? Okay, so that's an interesting question. Firstly, they're often starting with a different anatomy to start with. So one of the limitations to buttock fat grafting is firstly how much fat you can get into the buttock. So essentially, once the fat goes into the buttock, the tension builds up, and once it reaches a critical point, putting more fat in will just mean that less of the fat is going to survive. So certainly in some of those areas, particularly with African Americans, they genetically have more space to put fat in. There are also different goals. So for a lot of women, the goal is actually to shape the buttock. So when we think about the shape of the buttocks, we think about 4 different shapes. So the worst, or considered least attractive, is a V shape. Then we get a square shape where the hips and the flanks are sort of straight up and down. Then we get a round shape, which is sort of okay, but the best one is an A shape, where it tapers in from the waist smoothly out to the hips and then down towards the knee in the thigh. Now, a large percentage of my patients are after shape rather than size. Okay, but there is certainly a significant portion who are also after size. I think that there aren't a lot of surgeons who do this procedure regularly, and therefore there's a degree of concern about or inexperience about how much this can be pursued. Certainly the level to which a lot of the results you see in South America and the USA, there is more aggressive liposuction. And there's no doubt, though, that does come with a price. There's an increased rate of irregularities and so forth, and it truly is about the shape. The scarring of a Brazilian butt lift is another question. So the procedure is not an open surgical procedure, so it doesn't have long incisions or things like that. What we're doing is we're harvesting fat with liposuction. But to do this procedure, if you look at a lot of the literature, so a higher volume liposuction or fat grafting might be 600 to 800 and up to 1,000 cc into each buttock. So that's 2,000 cc into the buttock of fat. Now that's a fairly large amount of liposuction. So one of the first things, and it goes back to the first question of size and as opposed to shape, for girls who are slim, then a little bit of liposuction from a large number of areas is required to harvest that much fat, and in some instances we can't. One of the questions sent in prior to tonight was, how big can you go, and how much of that fat's actually going to survive. So the survival of fat, there's an interesting study that came out recently looking at fat grafting. Admittedly, it was to the breast, and it was looking at women who had several episodes of fat grafting associated with breast reconstruction. And then they were followed up with scans to see how much fat survived. So in that instance, it was very interesting because out of about 20 patients, they had a variety of different levels of, or different proportions of the fat that survived, but the average is about 60% to 2/3 of the fat that goes in will stay permanently. Okay, so if you put 1,000 cc into each buttock, then about 600 to 650 cc will be there permanently. Okay, but what was interesting is some would have much lower at 55 or 50%. Occasionally you get someone into the 70%. Yet each successive time that they had the procedure, a similar proportion of the fat survived. So there certainly are individual patient factors which we don't understand, but generally we'd say about 2/3 of the fats survived. But of course, at the operation, you also then get swelling. Okay, so post-operative swelling, just like when you have your lips, fillers into your lips, the lips will swell for a few days and then settle back down. Just like when you have breast implants, the breast implant swells as if you've got engorgement, and then the breast volume settles down. So that's all a fairly normal part of it. One of the elements of caution that needs to be considered when using fat grafting to increase the volume of anything is that the fat that survives are living cells. Now, once we get to adolescence or the end of adolescence, generally we've got a programmed number of fat cells. When we gain and lose weight, those fat cells go from sultanas to grapes. So they expand in size. So rather than getting new fat cells, the fat cells we have increase in volume. What that means is if you gain weight after fat grafting, that area will increase in volume. Okay, so it's different to, say, a buttock implant, which obviously has a permanent size, the same with a breast implant. One of the questions sent in prior to this evening was, what about fat grafting to the lip? That's something that, for me, I do periodically when I'm performing facelift surgery, and I do quite a bit of that. In fact, I use a lot of fat grafting, whether it's either breast reconstruction, reshaping breasts after removal of implants, or dealing with problem implants, patients where they've got contour irregularities or breast deformity, and the buttock, of course. But the best patient is the one that has a stable body weight over a long period of time. Because then you can work to create something, create a shape, create an aesthetic, create the curves, and then have a fairly reliable long-term result. Because the same thing happens with areas we've taken fat from. With weight increase, less fat will go there than used to happen. So it could potentially accentuate the proportional shift we've obtained. If we go back to the question of volume, as I said, one of the important things, even buttocks which aren't huge can be massively accentuated by taking away abnormal contours. So if we go back to the square buttock shape, okay, so you've got your hips and then your waist up there, but you've got that bulge of fat in the love handle area. just by reshaping that, okay, so that we have that A shape without increasing the volume of the buttocks to a substantial amount, already it's improved. Okay, so the volume then, and that's how we do this procedure. So what we need to look at is women have different depths of pelvises. Some have tall pelvises, which give us very long and narrow buttocks, okay, or V-shaped buttocks, and they're the hardest to work with. We have different shaped hips, different configurations of the femur where it joins the pelvis. So some go out wide, which enables us to create that A-frame or that A shape quite easily. We have differences in muscle volume. So women who have particularly lower quadrant muscle insufficiency or lower volume muscle, they have that squeezed or pinched bottom, that boy bottom look. And so a lot of what we're doing at the outset is, firstly, what we do is we address the frame of the buttock. Okay, so we're taking it away from the areas around, like the outside thigh, the love handle, the waist. We go all the way around the tummy often. So we start with the patient on their back. We liposuck the tummy. We might go onto the side, liposuck along the outside of the chest wall, up over the bra roll, into the back of the waist, into the lumbar region at the top of the buttock. We're trying to create that sort of nice curve from the lower back into the buttock. And then on the sides of the buttock, we're trying to redefine the shape. So that's the first thing we're doing. And then what we do is, with the rest of the fat, once we've got an A shape, depending on what the goal is, with the rest of the fat, we're then trying to create volume. So most of what we're doing is firstly shaping, and then creating that nice aesthetic shape, making sure there's enough weight or enough fat still in the leg. So it's not about skinny legs, big bottom. That creates what's started to become known as the chapa-chup butt. Okay, too much suction on the thighs, a big round bottom, and it doesn't look very pretty. Okay, we need to have curves. So it needs to come down, A shape, curve round, and go into the thighs, not round and then into the thighs. Okay, it just looks weird. And a lot of that's being created. If you're really slim, you can certainly get a bit of fat. It's surprising, but it does mean you have to do wide liposuction. So I had 2 patients having this procedure last week. And one of those girls had a BMI of about 19, and I was still able to harvest 2 litres of fat. But to do that, I had to do her tummy, her waist, and into the back, and I had to go from her hips down to her ankles, okay, which was part of the aesthetic goal. Partly we wanted to actually shape the whole leg, but, so that was fortunate. I was not certain we'd be able to get that much, but then we were able to return about a litre onto each buttock, okay. So that's certainly something that's a challenge for the slim patient, but certainly achievable. But sometimes, as I said a little earlier, it's as much about the shape, as much as it's a bit like breast implants. Often women considering breast implants are focused on their bra cup, they're focused on the size of the implant, whereas a pretty breast is a lot of the way there, and it's the same with a buttock. So sometimes, and this is true of a lot of plastic surgery or cosmetic surgery procedures, sometimes it's not so much what will I get to this point, it's about saying this will get you as far as your body is going to be able to get. So we can't always achieve everyone's goal, but that's where a proper consultation, sitting down and understanding the limitations as well as the possibilities come into play, because what is already there, what you bring to the operation, has a substantial impact on what can be achieved at the surgery. It's not, we're not working with Play-Doh. We can't just make Kim Kardashian on everybody, okay? But there are certainly some who can develop that sort of frame. Trish asks a question, what about someone who's lost weight? and certainly a lot of weight. Okay, so for anyone who's listening who has gone through the weight loss process, one of the things that you certainly notice is that the buttocks fade away and we get buttoctosis, and there are varying degrees of what we call buttoctosis, which is like breast. It's breast droop and it's buttock droop. And that's where at the curve of the, got to try and angle it so I'm looking at the camera. So when we've got a nice shaped buttock, we've got a curve that comes around and it doesn't overhang. Okay, so the buttock doesn't droop down onto the skin. So what we're looking at is the angle of the skin from the back of the thigh onto the buttock. And normal is about 10 degrees or so. And as it gets more and more and more, then we get higher degrees. Now that's largely deflation. Now for someone who's lost a lot of weight, a procedure like a body lift will help tighten and lift the skin and the structures that have dropped. But that's a common group of patients where I'm using fat grafting as well. Okay, so in the massive weight loss patient, in the patient who's gained a bit of weight through pregnancies, particularly lost that weight, got more active as the kids got a little bit older, got their body back, not quite the pre-pregnancy body, but their body back to weight, and the buttocks is often one of the areas that shows the tail of that journey through the weight gain, weight loss program. So fat grafting, to fill that completely without a buttock lift, if it's really loose, is going to improve it but not be overly successful. Whereas the person who's got looseness in the outside thigh, looseness in the tummy, and laxity in the bottom are often a perfect patient for considering a body lift. And with that process, certainly in my hands, with that process, all patients having a tummy tuck, all patients having a body lift have a lot of fat grafting, have a liposuction associated. And as I say to my patients, I'm going to be taking this fat, and you may or may not wish to think about buttock volume, but at the end of the day, I'm going to have for the fat there, and it's either going to be thrown away or used. So you don't need it necessarily, but you need to think about whether you want it. Because if you don't, it's going in the bin, and it would be a tragedy to work out afterwards, oh, you mean I could have had that? And then the option is over. So I guess that's why when I'm approaching my patients like that in that sort of area, in that sort of way, I'm making sure people consider all these things. Because one of the most important things about choosing the right procedure, if you're considering one, is to be clear in your own mind what your goal is. Because if you understand your goal and you understand all the different options that can be considered and what they're going to do, it becomes clear to you what operation is going to be best suited to achieve what you can achieve in that regard. A question is fat transfer suitable for the tear trough? Okay, that's an interesting one. The tear trough is a very unforgiving area. And we certainly go to an extent to particularly for facial fat graft, and we go to an extent to purify the fat, make sure there are no clumps, so that when the fat goes in, it goes in smoothly and evenly. As we talked about before, you get a proportion of fat that doesn't survive. The problem is if you get a lump that survives beside an area that doesn't, you can get lumpiness. So a lot of people are concerned about, or certainly very cautious about using fat in the tear trough, because in the lower eyelid, the skin is particularly thin. And anything you do and do wrong is visible. The other thing for the tear trough particularly, fillers are fantastic and they're safe and reversible. So a lot of people won't do that. Now, there are newer techniques with fat that are particularly talked about in Belgium and in some places in the States talk about as well, and they call it Nano Fat Transfer. So the fat is a little bit damaged, but it's really, 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 really fine, and it's almost like a slurry. And in those instances, it can be injected very close to the skin in thin-skinned areas. And people using that technique do occasionally use it in the lower eyelid, and also find that because the fat has a little bit of colour, it can potentially improve the dark circle type appearance that's due to the visibility of the blood and so forth through very thin skin. What's the cost of Brazilian butt lift in Australia? Well, depending on the goal, if for example, someone's having a body lift procedure and a lot of the work that you need to do the buttock lift is already being undertaken routinely by that procedure, all you're adding is potentially a little bit more liposuction and then the fat grafting. So in that circumstance, it may add on a few $1,000s onto the cost of a body lift. If it's undertaken on its own, that procedure might be $10,000 or something like that. But look, it's going to be different. It's going to be different. So it's probably it's a little bit more. It takes, compared to the time taken for breast enlargement, for example, a breast enlargement procedure, a first up breast enlargement procedure will take about 40 minutes. Okay, the surgical part. Obviously, there's extra time. The patients need to go to sleep. The surgery is done. The patients wake up. The patients goes out to the recovery room. So the whole process is allocated about an hour, but the operation takes about 40 minutes. A Brazilian butt lift, putting the fat in takes 20 minutes or half an hour. Harvesting all the fat takes 2 hours plus. Okay, and so in fact it's the liposuction, which is the degree of liposuction actually is what makes the process lengthy in time. And essentially from a hospital perspective, an anaesthetic perspective, and largely for the surgeon's perspective, those sorts of procedures are roughly billed on a time. Okay, an operation which takes longer costs more than an operation which takes less. And that's one of the things. And as I said before, for girls who are quite slim, we actually have to be quite extensive with the harvesting of fat so that we're not taking too much from any one particular area. Okay, so what is better, a gluteal auto augmentation or a Brazilian buttock lift? So for those who don't know what gluteal auto augmentation is, in some instances when we're doing a body lift procedure, okay, I'm going to draw a diagram. This will be easier to understand. So basically, okay, so, right, let's see if we can get that right. So, believe it or not, that's a bottom. So when we're doing a body lift, okay, we're starting with a cut that is at the top of the cleft, comes out here over to the hips like this, okay? But we're then removing skin like that above it. So what I do with my, typically with my body lift procedures is I am liposucking all of the fat under that skin. I'm doing it in a way that we're shaping the top of the buttocks, okay, so that we get that little bit of roundness there. We get a hollow in at the top of the buttocks to give that shape from the spine into the bottom, okay. But by doing liposuction rather than just cutting the fat out, I'm preserving the lymph vessels and I'm preserving the nerves and limiting or reducing some of the risks that are associated with this surgery, okay. Then I'm getting that fat and I'm putting it into the buttocks. So when I do that, I can put it where I want it, okay? So if we've got someone who's got that sort of shape, a pinched sort of bottom look, then I'll get that fat graft and I'll put it out here, okay? If we've got deflation and we've got loose skin down here, then I'm going to be putting the fat into that area to build that back out, to blow the balloon back up, if you like, okay? Now, if I'm doing auto-augmentation, what I'm doing is I'm looking at the width we want the buttock, which is about 15 or 16 centimeters, okay? And in this area, I'm keeping that bit of skin there, okay? Oh, sorry, that bit of fat. I'm taking the skin off. I'm lifting this up here, and I'm folding this back down and suturing it down there, okay, so that the fat that otherwise I would be harvesting up here with the liposuction is then folded into the bottom. So then when everything's pulled back over the top, you've got normal fat creating volume. I've done both. In fact, I used to always do this before I started doing fat grafting, and now I always do fat grafting. So why is that? Sometimes when you do auto augmentation, the results are spectacular and great, and you love them, and sorted, done, dealt with, 100% of the fat survives. Other times, this is too much like an implant in the wrong direction, and you get a bumpy butt rather than a smooth round bottom. So when I'm using fat grafting, I can create an even shape. I can not just look at the A shape, round shape, square shape, V shape, and correct that into an A shape, but then I can look at the projection of the buttocks, depending on what the goal is, and create something which is even and full. So for me, I prefer using fat grafting or a Brazilian buttock lift as opposed to auto augmentation. Do you fold that skin under? Okay. Okay, so it really, a lot of people have done things like put creases in the fold, as incisions in the fold, okay, to try and support this, to try and decrease the loose skin. I don't do that at all. Okay, there are many more bad results from that than successes. Okay, so what I'm doing is I'm trying to reflate that, and if the buttock is that loose, then that sort of looseness is going to be all the way around, and I'm going to be talking to people about a body lift. Okay, and quite surprisingly, not all patients having a body lift are massive weight loss patients. So for some patients, particularly post-pregnancy, there's a bit of loose, and there may have been a degree of weight gain. Might have gone from 60 to 80 with pregnancy, back down to 60, 65. And for some people, they're going to have laxity all the way around. And they're unfortunate, but that's the way it is. Everyone's different. We have different body shapes. We have pears. We have apples. We have different buttock shapes. We have people with visceral fat in their belly with skinny arms and skinny legs. With the fortunate that are curvy and have an hourglass type figure. And an hourglass type figure can be like Kim Kardashian and can be full, or it can just be slimmer. So everyone is different at the outset. So everyone's going to get something different. But for those that have still got that looseness, even when they're relatively slim and never got terribly large, sometimes a body lift is going to be one of the things that we're considering to tighten up the outside thigh and to tighten up the buttock skin, where volume alone is not going to adequately do that. Okay, so it's a bit like if you're a builder and you've only got a hammer, everything looks like a nail. Okay, what we really want to do is look at all of the elements that are contributing to the concern that a patient sees and work out the ways we can address that. So if skin laxity is a major concern, then at some point we're going to need to at least consider excisional procedures like a body lift, if we're talking about the buttocks, like a tummy tuck. And for some people, it'll be a mini tummy tuck if they've got good skin. For others, it'll be a full tummy tuck. It depends on the individual, and it depends what we have to deal with. But as I said earlier, it's about working out what elements might be applicable, what the differences are in terms of outcome, and if you set your goal, it'll be very obvious what the best combination or single procedure is going to allow you to reach or get as close as you can to your target. And that's really quite important. How long before you can sit down and do your weight compression? I don't put compression on Brazilian buttock lifts, but there are garments with the buttock removed. One of the things is you can sit, but I get people to go down to Clark Rubber before the surgery. They get a nice thick bit of foam. You cut it out, a little bit like a hemorrhoid cushion for those unfortunate few that needed them, particularly after pregnancy, except it's much thicker. And for 2 months, every time you're sitting in that cushion. So whether it's at the dinner table, whether it's in front of the telly, whether it's in your car, whether it's at the office, okay, you're sitting in that. It does two things. It molds the shape of the buttock because it's a round cup. The second thing is it reduces some of the pressure in the buttock from directly sitting on it. As we said right at the beginning, there is a limit to how much fat can go into the buttock. And part of that limit is when the pressure gets too much, you just can't physically put more in. Because of the pressure will just make it squeeze out the hole that you're putting the cannula through. The other thing is that all of these little fat cells need to get blood to survive. So if you're putting it in great big clumps of fat, that won't survive. So you need to have it evenly spaced through lots of different planes, from the skin down to the superficial muscle, so that all of those little fat cells have a close association with blood supply. Otherwise, they won't survive. So when you try and overstuff it to try and achieve a better result, you're a little bit doomed, because what will happen is you'll have a reduction in the survival rate. So we go from 60% down, okay? Sleeping, I get people to, you can sleep on your stomach, of course, but at the start, I get people initially in the first night, they go side to side. Stomach is the best. And if you haven't had it, but if you've had a tummy tuck, a stomach's not practical, because everything's so tight down the front that in fact you're sleeping a little bit bent. So if you haven't had buttock fat grafting and you've had a tummy tuck, you're on your back with pillows under your knees so that you've got the pressure taken off your tummy, because your thighs and your tummy are at an angle. So if you've had a tummy tuck and Brazilian butt lift, you're on your side, okay, so that you don't, so it takes the pressure off the, so you don't have the pressure on the tummy from lying flat, and you don't have the direct pressure on the buttocks. Okay, so recovery and return to work. 7-8 hours a day in front of the computer. How long before you can reasonably expect to return to work and work a full day at my desk? Okay. With the cushion, a lot of people would be back at about a week. Okay. If you had the opportunity to either work shorter days, have a standing desk, or just take extra time off, then 2 weeks might be a little bit better for the fat. By then, the pressure has reduced a fair bit. The swelling has probably about half of the swelling has gone at 2 weeks. So everything's feeling a little bit more normal. The bruising has settled as well, which has taken a little bit more pressure off. So that's going quite well, but we're still waiting for the fat to really take on its blood supply and survive. Okay, and that's really a 2-month period in which I say, and do we know it's 2 months? No, we don't know it's 2 months. Okay, that's what works. That's what gets us those results. Was 6 weeks going to work? Possibly as well, we don't know. But if 2 months works with the cushion, this is not 2 months out of circulation, 2 months with the cushion, we find that's going to be very good for the fat. It's going to give us a good result. And by that point, most people are sort of, the cushion is just part of life. It's on the chair. It's not like you're carrying it around on your head. So it tends not to be too much in the way. Let's see what other questions we have that I may not have got to. Where do we usually take the fat from? So I guess the commonest areas are what we call circumferential trunk liposuction. So that's taking it from the rib cage down to the pelvis on the front, in the flank, the bra roll, in that area above the buttocks and the pelvis. And we work pretty hard there because we want to, as I said before, we want to create that curve through the spine and onto the buttocks. Okay, so we want to take fat away from this area here in the area of the back above the buttocks to accentuate the shape, or that part of the shape anyway. Working hard on the love handles as well, because often it's the love handles which gives us a square buttock shape or a V buttock shape, and that's an area where we're focusing on. often we want to reduce the saddlebag or the outer thigh, but gently. Earlier again, I talked about the chapa butt, okay? Big round bottom, or even an A-frame bottom, but a nice full bottom, but skinny legs, okay? So it looks like a chapa on a stick. What we want, the way to support a big bottom is to have a bit of volume in the top of the back of the thigh, in that fold underneath the buttock. It needs to support it, and a little bit of volume on the outside, because we're going for an A shape. We're not going for a round shape or a flat shape, okay? We're going for curves. We want the waist to come in, out, and round into the outer thigh smoothly, okay? And to do that, we do need enough volume in the outside and the back of the thigh, but there's often quite a thickness of fat in the front of the thigh, and obviously no one really wants too much fat in the medial thigh or the inner thigh. So those are areas we work on. For some people, we'll take the fat from around the knee, especially for people who think that their thighs don't have shape, they just go up and down. So we'll try and taper the thigh so that the knee is more defined as a knee rather than just a junction between a straight thigh and a straight calf. For some people, I'll be trying to sculpt the lower part of the leg around the ankle, but there's not much fat that comes from there. It's visible, the outcome is visible, but the volume is low, okay? So they're the areas where we're getting the fat from. How long do we expect the results to last? So once we get to about 4 or 5 months, the volume doesn't really change. Okay, so the volume at that time compared to the volume at 12 months is probably is very similar. So the fat that's not going to survive, the third of the fat that's not going to survive, and the swelling and the bruising is going to settle over those first 4 months or so. And what we have at that point is largely going to be permanent, apart from weight fluctuations. Gain weight, bottom gets bigger. Lose weight, bottom gets smaller. Okay, so what we have at that point is more or less permanent. Okay, the operation, the recovery from this operation, is there pain? You know, what's the pain? If anyone out there's had liposuction, you know, a lot of people think of liposuction as a small cut and just sucking out some fat. That doesn't sound too bad. Don't need my fat to walk. Don't need my fat to get dressed. Don't need my fat for much. So therefore, that doesn't sound too painful. Problem is we've got long cannulas and they're bumping into muscles. And when we're doing something like this and we're taking fat from the stomach, fat from the flank, fat from the back, fat from the thighs, it's a bit like you've tumbled down a hill without breaking a bone. So you've got aches and discomforts everywhere, but it is more aches and discomforts rather than pain. And you have, and those sorts of aches and discomforts are noticeable, particularly for the first 3 or 4 days, and then they're rapidly getting better. Okay, so by the time we get to a week, people are usually very comfortable. Okay, they might still be taking painkillers, particularly at night. Okay, because a bit of discomfort during the day when your mind's on other things is quite okay sometimes. When you go to bed and you're trying to clear your mind, little distractions can stop you from sleeping. So often people still be taking a little bit of pain at that 1 week period, just to sort of help drift them off to sleep. But by and large, they're pretty comfortable at that point. What sort of pain? Yes. Yeah. So the actual, because so the pain is certainly quite significant in that first little period, and that's because we're doing such big areas. Okay, if we're only doing small amounts of liposuction, you know, for whatever reason, say it's just on the flank, tummy tuck, or if it's just on the side of the breast, that little roll that goes into the armpit from the side of a breast when I'm doing a breast reduction, often those areas aren't terribly uncomfortable. But when we do something like a breast reduction, quite unexpectedly, often it's the liposuction which is more uncomfortable than the breast reduction. So liposuction is not always as straightforward as it seems to be. So look, I think it is a procedure which is topical. It is a procedure which is common for some people who are performing surgery or performing body contouring surgery. There are safe ways to do this, or safer ways to do this. There are substantial risks for people who aren't familiar with the safety aspects of this surgery. Okay, in America, there have been some deaths from this surgery. So it is important that it's done by someone who's properly trained, who has experience, and most importantly, has an understanding of how to make this safe. Okay, there's been a great working group in the US by some colleagues of mine who looked at everything from even the autopsy reports on why people have met bad outcomes with this sort of surgery. And so there are well-recognised safety measures that can be incorporated into the procedure to make it as safe as possible. So anyone thinking about this surgery, I'd firstly be asking whoever you are seeing, how often do you do it? Okay. As I said, for some of us, it's quite common, whether it's just for shaping with body contouring of other sorts, like a tummy tuck, or whether it's just for this. That's important because there is no doubt the more you do, the better you achieve with everything. The other thing is to ask them, are you familiar with the methods to make this as safe as possible? And so another question, if still having buttock fat transfer, is the patient under general anaesthetic? Absolutely. To get enough fat from the body, I have to take, if we're doing, particularly if we're doing fuller volume buttock transfer, so 600 or above cc on each side, then if we're not doing a tummy tuck or a body lift procedure or another body contouring procedure already, which will allow us to harvest a lot of that fat, then we need to do widespread liposuction all the way around the tummy, all the way around the trunk, in the thighs, things like that. And that's not something that is going to be safely or comfortably performed under a general anaesthetic. It's just not a straightforward procedure under those circumstances. So it is something that has to be done properly in an accredited facility for your safety as well as for the outcomes. Because at the end of the day, there's no use having a cheaper, quicker, uncomfortable procedure, and the discomfort interferes with the completeness of the procedure. Because at the end of the day, undertaking something like this, you're undertaking it to achieve an outcome. And if the outcome is compromised by not being able to do the operation properly, then a cheaper price is not good value. So I would never undertake this under general anaesthetic. I'd be undertaking it in an accredited hospital with a proper anaesthetist so that we can monitor every aspect of it, including the safety. Because safety, it's sort of fun to talk about these sorts of things because the results are things that people like, okay? But at the end of the day, it's got to be something that is safe and reliable and is going to get you to a place where you want to be. And if it's not going to get you there, someone needs to have the guts to stand up and say to you, this is not going to work for you. I'm not sure your goals are realistic, or what we can achieve and what we can do for you is not going to achieve what you're after. And people need to be able to tell you that as well. And certainly, I don't operate on every patient I see because I know what I can achieve safely, what can be done properly with this operation, as with other operations. And there are points at which we go beyond that. We don't make better results. We make things look different, and then we make things look weird. I'm sure you've all watched, or well, not all of you perhaps, but I'm sure many of you have seen Botched. That show with Paul Nassif and can't remember the other guy's name at the moment, Beverly Hills Plastic Surgeons, nice guys. And it's great, it's an interesting show. But those things have been, those patients that they see are when procedures are pushed beyond where they can go, And it's important to understand and to be talking with someone in consultation that understands that where the limitations are. And this is one of the most important things if ever considering something. You need to understand what your goal is. Because if you can display your goal clearly, it makes it so much easier for a surgeon to go, aha, I know what we need to do to get that. Or, okay, we're not going to quite achieve that for this reason, but this is what we can do. And this is where your goal and the outcome needs to match. One of the biggest areas where I see this is someone with a bit of breast droop who wants implants, and they don't want the scars of a lift. Who wants the scars of a lift? No one. Okay. So in this group, what we do is we go, okay, for this particular woman, if we don't use a lift, this is the sort of outcome we're going to get. And it'll often have a little bit of volume at the bottom of the breast. The nipple will sit low. There'll be loose tissue at the bottom of the breast. Okay, but we can get a volume. We can use an implant. And as long as the nipple's still on the front of the breast, that can still be good. It can be still a nice, mature looking breast. But if we're trying to achieve full breast aesthetics with the nipple halfway or a little bit above, looking slightly up, a nice gentle curve underneath, and a nice slope to the upper part of the breast, unless you're fortunate at the outset, we may need to consider a lift. So for a girl in that position, considering this surgery, I say to her, now the most important thing for you is to understand what your goal is, because that'll tell you whether you need a lift, and you'll tell me what I need to do. Okay, it's no use me telling everyone, this is what you need, off you go, we'll do that, and I'll make the world into the same person everywhere around. That's not how it is. It's about you understanding what aspects of the particular procedures are so that you can work out for yourself what you're likely to need to get that result. And then look at lots of photos. And ideally, the person you're seeing is going to show you, this is why I think we need to consider this for you. And if we don't, we're going to get this outcome. And here's a photo of someone in exactly your circumstance who chose that path. Okay. So it's the same with any of these aesthetic surgical procedures, whether it's facelift, whether it's breast reduction, whether it's augmentation mastectomy, breast asymmetry, body contouring, body lift versus abdominoplasty, lipoabdominoplasty versus abdominoplasty, buttock lift versus body lift, all these things. There are often options, and it's about choosing the one that's going to take you to your goal. And as I've seen on comments, you know, there are people who say, I'm happy with a mature looking breast, particularly when they're not 20. And I've got lots of patients like that. Okay. Just because a procedure can be performed, it doesn't mean it has to be performed. As I said, it's about understanding what your goal is. So someone, particularly if the nipples are on the front of the breast looking forward, if they're a little bit low and we use an implant and we still have a nipple pointing forward, we can see breast skin under the areola before it gets to the chest. So the nipple's still a little bit highish, okay? That can be a beautiful breast in the right person as long as that is the goal. It's not cookie cutter surgery. It should be tailored to you. Excellent. Well, ladies, I hope you've enjoyed the chat. I presume it's mainly ladies that are on tonight. And certainly the comments were. It's been nice to meet you all. As I said, my name is Mark Magnusson. I work at the Steam Medispa on the Gold Coast, a law clinic in Toowoomba. I'm the current president of the Australasian Society of Aesthetic Plastic Surgeons. So thank you so much for taking out part of your evening, and I look forward to doing it again at another time, if you'll have me back. Thanks, Trish, for the invite. Bye, ladies.